Welcome to the Front Porch podcast. I'm Jessica Alarcon, and I am here today with Brandon Harris, Director of the Ambulatory Clinics with UC Davis Health, and Dr. Bullen, Associate Medical Director of Community Physicians. So welcome.
That's a mouthful.
It is. I'm sorry, I read that right, yes?
Yep.
Very good. So thank you both so much for coming today. And you two are both associated with this, you call this an outreach clinic, vaccination clinic here at City Church in Oak Park. So just to start, I'm going to ask you a little bit about yourselves, where you came from, what got you interested in medicine, and how you ended up here in Sacramento.
Sure. So I'm originally actually from Michigan, but my wife is from this area. So I came here and actually did my residency in general pediatrics at UC Davis and have been here mainly as a general pediatrician, although over the last 3 years have mainly been in administration with our community clinics, which are the primary care clinics throughout the Sacramento region.
Okay.
So again, my name is Brandon Harris, and I was a product of a military home. So born in Virginia, but then moved over to the California area back in the early 80s. But then spent a lot of my formative years in North Carolina for high school, college. Well, actually, college was down in the Atlanta area. And originally, I was going to go into medical school, and I was a music and sociology double major, pre-med concentration, weird combination. But then wound up getting really, really interested in terms of health administration, and more specifically, hospital administration and policy. So I was able to receive my master's in health administration with a concentration in healthcare finance and policy from The Ohio State University. I don't know how Dr. Bullen and I are not at odds right now with him being a Michigan grad, so, but we find a way to make it work.
That's right.
So I've held a number of administrative posts throughout the country, ranging from Seattle, Washington, Toledo, Ohio, Chicago, Illinois, and then finally find my way back out here to the California area, serving as the practice manager for internal medicine and specialty clinics, which was a large multidisciplinary, multi-specialty facility clinic here at UC Davis Health.
Okay, so what exactly made you interested in administration, the administrative part of healthcare?
Sure. So again, as I stated, I originally was going to go to medical school, but I saw a large disparity in terms of a racial and diversity gap in the administrative levels. And so I felt that I was probably better suited to be a suit compared to wearing the white coat in order to be able to affect the change and leverage my education, be able to marry philosophies of, no margin, no mission, but at the same time, patient-centered care is where we need to be, leading ourselves. And so really trying to figure out how I can optimize the education and lead an organization towards being able to be financially solvent, but at the same time doing what's in the best interest of the patient. I think there have been a lot of times where there's been more consideration based off of, financial gain, but not necessarily community outreach.
Okay. Oh, that's really great. Thank you for sharing that. And Dr. Bullen, for you, what was it that led you into pediatrics?
Well, it's sort of funny, right? I like kids. I mean, that's the easy answer. But when people choose medical specialties, I think often the initial choice is, do you want to be in a surgical type field or a medical field? And I knew I didn't want to be in a surgical field. And then, do you want to be a subspecialist or a primary care doctor? So then I wanted to be a primary care doctor where I developed long-term relationships with patients and families. And in reality, I'd much rather take care of children than adults. And that's why I ended up in pediatrics. My wife's an internist, so she wants to take care of older people, and I take care of the kids. So, and then, here I am finding myself helping vaccinate 90-year-olds. So there you go. I mean, it's all good. And I think some people might seem at think it's odd that a pediatrician is taking a bigger role in vaccinations where it's mainly, at least right now, for adults. But that's a lot of what a pediatrician does, is practice preventive medicine through use of vaccination and education about vaccines with patients. And so, that's one of the reasons that I'm working on this project.
Okay, that makes sense. In the past 12 months, things, I imagine, for the two of you, your professional lives changed quite a bit. Can you describe what that has been like for you, beginning around this time last year and through this last 12 months?
Yeah, kind of going back to your first question in terms of why I got into health administration, and I kind of referenced the disparity in terms of racial representation. That was one of the really big pushes because, again, in terms of being able to be a CEO or a COO, a CFO of a large tertiary organization that is serving, a vast variety of races and ethnicities, but not necessarily being reflective of that in senior level management, it really was what kind of pushed me in terms of going into that discipline. And so when you ask the question in terms of what the last year has been like, I feel as though I've been kind of living double lives for the past couple of years, because on one end, I'm really trying to see how we can push and edify our public in terms of what is going on, and information is changing daily, hourly. But then as an African American, I sometimes even this past weekend was sitting in the barbershop and we have, barbershop talk. And, a lot of people are questioning, have you gotten the vaccine? Why are you getting the vaccine? You know what happened with Tuskegee and, and many other types of, situations. And so really being able to try to figure out how I fit into both of those worlds, and trying to ensure that people are well-versed and well-edified, because I think there's been a lot of mistrust and misinformation and, misrepresentation of things in the past that has led to some consternation and trepidation from people now. And so as a representative of UC Davis Health, trying to understand that, while I can't necessarily rectify the rights or the wrongs of the past, we still have to figure out how we can work within this current situation, this current pandemic, and ensure how we're able to effectively engage with all members of the community and not necessarily, silos, which is what kind of led to this effort with us with the vaccination clinic here in Outreach.
Yeah, and for me, obviously the last year for everyone in the country has been totally abnormal. And in medicine, we typically have a good knowledge of what's going on. And when you have a new viral illness, you can make a lot of guesses as to how it's going to behave and how things are working. But in reality, you don't know. So things have changed almost every single day. Something is different. And so messaging change is very important, not only for the public, but also for all the physicians and care teams who are taking care of patients. It's really hard to, say that this should be our course, and then you start deviating from that. And I think that can create, mistrust in the public, as well as with physicians and nurses, to make sure that everyone knows we're doing what we think is the best with the information we have right now. And certainly, I think we're really at a turning point now. We have good understandings how to prevent spread of this illness. This is what we do. We wear masks. We wash our hands. We socially distance. That, in and of itself, is one of the major tools. And now we have a huge tool, a vaccine, which can help us prevent spread and keep people from getting sick. So now our job is to get that vaccine out to as many people as we can, and certainly get it out to the people who are at greatest risk. And those are people like this community in Oak Park, where there is fear of the vaccine. So partnering with Pastor Meeks and City Church is a great way to help bring people into a comfortable environment where you can talk about that fear and get, put that aside, and also to vaccinate higher risk people. So the African American community, the Latinx community, all have higher rates of death and COVID infections, as well as, unfortunately, lower vaccination rates. So we need to get the vaccine to the people who need it the most. And that's one of the reasons we're here today.
Okay. You answered like 3 of my next questions in your answer to that one. So one of the things I was going to ask is, and you definitely spoke to, one of the major differences between now and a year ago, in addition to, having this year's worth of experiences, is this vaccine. Is there anything else you think has changed much in the way that you are going about your business, over the course of this year that's different now than it was a year ago?
I would probably say, just as a representative of UC Davis Health, that we take this mission of being a representative of all of our communities very, very seriously. And I think that the pandemic has afforded us an opportunity to be even more intentional in that endeavor. I think, again, kind of going back to what we spoke about earlier, we have really worked hard to communicate updates, correct misunderstandings, manage expectations to the best of our ability around vaccine side effects and distribution. And of course, that changes so regularly. And because of that, it affords an opportunity for people to engage or to feel as though information is not being shared, appropriately, or that maybe the information is a little bit asymmetrical in some way, shape, or form. But I think that because we recognize as members of UC Davis that we are the representatives of Oak Park, of Roseville, of Folsom, our high communities in terms of socioeconomic status, as well as those who have been misrepresented for such a long period of time or underrepresented such for a long period of time. So I think that we have just become very, very intentional and very direct in terms of engaging with staff and engaging with our patients, engaging with their families, engaging with the communities. I think that, not to be metaphorical, but we've really strive to become bridge builders, and ensuring that, we're not just here because we're trying to give a vaccine today, and we recognize that this has been an underrepresented area, but we're literally half a mile up the road, and you all are our patients as well, too. Mm-hmm. So I think we really have been striving to be a community partner. Mm-hmm. And I think that while the pandemic has shared or allowed for some negative things to have occurred, between death and sickness, I think it's also been a strong opportunity, for us to really revisit who we are and where we fit within this organization, where we fit within this community. The community doesn't need to fit around us. We need to fit within it. So I think that we really have, taken a lot of opportunity to really kind of engage in that regard.
Okay. Thank you. And you guys are just doing a great job of anticipating my questions. And have to think about how to reintroduce them in a different way. So, you've mentioned you're right here adjacent to the Oak Park neighborhood, where, many of the residents feel like, access to medical care is a barrier, and proximity doesn't necessarily mean access. So what do you think are the best ways to improve true access to the community?
I think doing things like this,
Okay.
right?
Yeah.
I mean, you take a trusted, leader in the community and partner with them. And, Pastor Meeks can bring his community, the City Church community, in to us so that we can help vaccinate and show that we all are working for the same thing. And, rather than saying, oh, well, you're a mile away or 2 miles away from our vaccine site, get in a car or walk or ride your bike or take a bus to us, we'll come to you. And, we can then help people who I think that, it's interesting last week, and I'm glad that we're doing this after our first clinic because we've learned things. And, last week I sat down and talked to a woman who said that she was really afraid. And she wouldn't have gone to a big clinic. She felt safe here, but was still afraid, and then needed to be reassured. And I think that by showing, the compassion from the community as well as from the medical community who's helping meet people where they are, that's really helped bring the needed vaccine to the community. And then, you had asked how other things have changed, and I think that UC Davis Health is a really big organization. Mm-hmm. Yes. And what has changed, I think, over the last year is that this horrible pandemic has allowed sort of all the leaders to come together to work for a common goal. And that has been something that, probably wouldn't have happened had we not had this common foe to fight. So that, that was a good thing for this huge organization. And it certainly brought the medical community together too. I mean, there are lots of partners, working with health systems, working with public health people, working with various community organizations to get care to where it's needed.
And I would also just kind of add, I think at its simplest form, in order to kind of improve access, we have to acknowledge that there is truly an issue. Okay. And I think for such a long period of time, there's kind of the systemic disparity, mm-hmm. Systemic racism, discrimination, homophobia, xenophobia, have led to kind of multiple unethical types of treatment and horrible incidents. And so UC Davis has really been doing so much work in terms of our diversity and inclusion initiatives. And that extends just beyond, outside of just within our own framework as an organization. I mean, we're experiencing that and extending that out to the communities such as Oak Park. We recognize that there are vulnerable populations where there are less vaccine sites compared to that of a larger institution like UC Davis, where we've had 2 at one point, but where were they here at Oak Park? Where were they at St. Paul? Again, underrepresented areas that we really feel and know that we need to do a better job in.
Okay, thank you. So you mentioned that you've learned a lot. This clinic opened on Friday and had a day of vaccines. I'm curious, what have you learned?
Well, I think that one of the important things that we've learned is that people in need mm-hmm. will come if they are welcomed in a safe space. And, this is a safe space for a lot of members of this community. And, hopefully we can't vaccinate everybody in the community mm-hmm. at this space. But hopefully that will allow those people to go out and tell their family that, hey, it's not that bad. You can go to one of these bigger sites that might be maybe a little more uncomfortable for you. So I think that's an important learning piece, and people with fears can be allayed by their family members and by their community, and hopefully we'll get the vaccine rates up in these in the communities where the rates are lower by showing that things are safe and inviting to our bigger sites as well.
I think Dr. Bullen said it all. I would say that we have seen the resiliency of people, as underrepresented as they may have been, or maybe felt that they were even invisible. We have to realize, as UC Davis, as large as we are and as well known as we are locally, nationally, we can't do it all by ourselves, and we have to rely on our community partners. And so working with Pastor Meeks and having him kind of serve as the point of contact and kind of a liaison between the community and UC Davis, we've really had to kind of figure out how we can better align ourselves with our leaders, with our community partners, to hopefully engage in something at this level and even growing, at higher levels, and realizing that, once again, that we can't do it all, we don't know it all, and so we have to understand our communities and understand what fits within their wheelhouse, and seeing how we can best support them, where they are comfortable, as Dr. Bullen had stated. So, yeah.
Okay, thank you. I think we're out of time. Is that correct? So thank you so much for coming, for your concern and engagement with this community, and sharing, your perspectives. And yes, I really appreciate that.
Well, thank you for letting us get the word out.
Absolutely.
Thank you. Hello, my name is Brandon Harris. I'm a member of the UC Davis family. And UC Davis, we're committed to not only being your provider of choice, but to also be your partner and advocate. At City Church, we're engaged in an endeavor of love and community with Oak Park through the vaccination of members of this historical and important community. Oak Park, we want you to know that we see you, we hear you, and UC Davis is here for you.
Hi, I'm Tom Bullen from UC Davis Health as well, and I'm encouraging you to contact City Church for a vaccination for COVID-19. You can call 916-349-6980. We'll be here every Friday vaccinating the community of Oak Park. We know it will help you, it will help your family, and it will help your community. These are highly effective vaccines and very safe. Please call and see us on Friday at City Church.